Dr. Chris Palmer, a psychiatrist, discusses the current state of the mental health field and the need for a shift in understanding and treating mental illness. He believes that the primary issue lies in the fact that the field has yet to fully comprehend the root causes of mental illness. As a result, treatments often focus on managing symptoms rather than addressing the underlying causes. Dr. Palmer reflects on his own experience as a psychiatrist over the past 27 years. Initially, he believed that finding the right medication would be the key to curing mental illness. However, he became disillusioned when he realized that many patients did not respond to medication or experienced only temporary relief. He observed that even highly functioning individuals would experience relapses or chronic symptoms despite being compliant with treatment. He argues that the current approach to mental health, which often combines medication and psychotherapy, is limited in its effectiveness. Many mental health professionals believe that mental illness is caused by a chemical imbalance in the brain, and that medication can correct this imbalance. However, Dr. Palmer challenges this notion, pointing out that the majority of serotonin, a neurotransmitter often associated with mental health, is actually produced in the digestive tract. This highlights the importance of the gut-brain connection and the role of the gut microbiome in mental health. Dr. Palmer's perspective shifted when he began to explore the idea that mental disorders are actually metabolic disorders of the brain. He discovered that metabolic dysfunction, particularly in relation to mitochondrial function, plays a significant role in mental illness. This led him to consider the broader factors that contribute to metabolic dysfunction, such as diet, exercise, sleep, stress, environmental toxins, and chronic infections. He emphasizes that mental disorders should be understood as malfunctioning brains, where cells and networks are not functioning as they should. Metabolic dysfunction compromises the structure and function of brain cells, leading to symptoms of mental illness. Dr. Palmer argues that this metabolic dysfunction is the root cause of mental disorders, rather than a chemical imbalance. He provides an example of a case study involving a woman named Doris, who had a history of abuse and trauma and was diagnosed with schizophrenia. Despite trying various medications, Doris continued to experience hallucinations and delusions, gained weight, and struggled to function independently. However, when she made significant changes to her diet and lifestyle, her symptoms improved dramatically. She lost weight, gained mental clarity, and regained control of her life. Dr. Palmer shares the story of a patient named Doris who suffered from paranoid schizophrenia for most of her life. Doris decided to try the ketogenic diet, which she learned about at a weight loss clinic run by Dr. Eric Westman. Within 2 weeks, Doris started losing weight and noticed a reduction in her auditory hallucinations. Within 6 months, all her symptoms of schizophrenia were in full remission, and she was able to stop taking psychiatric medications. Doris lived symptom-free for another 15 years and lost 150 pounds. Dr. Palmer emphasizes that Doris's case is not an isolated anecdote. There are numerous individuals who have achieved remission from bipolar disorder and schizophrenia using the ketogenic diet. He also mentions that there are ongoing controlled trials to further explore the effectiveness of this diet in mental health treatment. The ketogenic diet, originally developed as a treatment for epilepsy, has been extensively studied for over 100 years. It has been shown to improve mitochondrial function, reduce inflammation, change neurotransmitter levels, and alter the gut microbiome. Dr. Palmer believes that the ketogenic diet's ability to improve mitochondrial health is the key to its effectiveness in treating mental illness. Mitochondria are responsible for energy production in cells and play a crucial role in overall metabolic function. When mitochondria are dysfunctional, cells become metabolically compromised, leading to various symptoms associated with mental health disorders. The ketogenic diet stimulates processes such as mitophagy, elimination of old and defective mitochondria, and mitochondrial biogenesis, production of new mitochondria, resulting in improved mitochondrial function and overall metabolic resilience. Dr. Palmer acknowledges that there are ongoing debates among researchers about the exact mechanisms through which the ketogenic diet improves mental health. Some argue that it is due to changes in the gut microbiome, while others focus on neurotransmitter imbalances. However, he believes that focusing on mitochondria provides a comprehensive understanding of the diet's effects. The conversation then shifts to the broader concept of lifestyle as a treatment for mental illness. Dr. Palmer highlights that lifestyle changes can be a powerful form of treatment, not just for prevention but also as a therapeutic approach. He emphasizes that lifestyle interventions, such as diet, exercise, sleep, stress management, and toxin avoidance, can all impact mitochondrial function and contribute to overall mental health. Regarding trauma, Dr. Palmer explains that trauma causes a flood of stress responses in the body, leading to metabolic changes. Mitochondria are directly involved in the stress response, releasing adrenaline, regulating cortisol synthesis, and influencing inflammation and gene expression. Trauma can leave the body in a state of hyperarousal, affecting sleep, cortisol regulation, and overall metabolic health. He suggests that a comprehensive treatment approach should address both the psychological and physiological aspects of trauma. Dr. Palmer also discusses the impact of environmental toxins on mitochondrial function. Substances like alcohol, marijuana, and cyanide can act as mitochondrial toxins and contribute to the development of mental illness. Dr. Palmer continues by explaining that there is a growing body of research showing that certain toxins, such as alcohol and the chemicals found in cigarette smoke, have toxic effects on mitochondria, the energy-producing organelles and cells. These toxins can lead to a wide range of mental and metabolic disorders, including depression, anxiety, schizophrenia, bipolar disorder, obesity, type 2 diabetes, heart disease, and even cancer. He uses the example of cigarette smokers to illustrate the connection between metabolic health and mental health. Despite being thinner on average than non-smokers, cigarette smokers are more likely to develop heart attacks, insulin resistance, type 2 diabetes, and various mental disorders. This demonstrates that metabolic health is not solely determined by weight, but also by mitochondrial function. Dr. Palmer argues that mitochondrial dysfunction underlies the development of mental health problems, obesity, type 2 diabetes, dementia, and many forms of cancer. He suggests that by focusing on improving mitochondrial function through common-sense lifestyle strategies, such as diet and exercise, it is possible to prevent and treat a wide range of mental and metabolic disorders simultaneously. The discussion then shifts to the impact of screen usage, particularly in children and teenagers. Dr. Palmer expresses concern about the excessive screen time children are exposed to, both at school and in the evenings. He highlights the negative effects of screen usage on sleep, cognitive function, and social connection. He suggests that schools should avoid giving homework on screens in the evenings to promote better sleep and overall well-being in children. The conversation also touches on the role of diet in mental health. Dr. Palmer acknowledges that there is no one-size-fits-all diet for everyone, as dietary needs vary depending on individual factors. However, he emphasizes the importance of consuming real whole foods, avoiding processed foods, and minimizing the consumption of added sugars and artificial sweeteners. He cites research showing that artificial sweeteners may have adverse effects on metabolic and mental health. Dr. Palmer continues by emphasizing the need for a holistic approach to health that considers the interconnectedness of mental and metabolic health. He argues that by addressing lifestyle factors, such as diet, screen usage, and social connection, it is possible to prevent and treat a wide range of mental and metabolic disorders. He believes that this approach can improve the lives of millions of people, reduce suffering, and save healthcare costs. Dr. Palmer acknowledges that he used to dislike the taste of water and relied heavily on sugary drinks like Kool-Aid. He also had a preference for sweetened milk, such as chocolate milk. However, he realized that these habits were detrimental to his health and decided to make a commitment to give up junk food and sugary drinks. He acknowledges that the first few months of giving up these addictive foods can be challenging, with cravings and irritability. However, he assures listeners that if they can persevere for 3 months, their perspective on food and their overall well-being will change. Dr. Palmer addresses the common argument that he turned out fine despite consuming junk food and sugary drinks. He shares his personal story of struggling with mental illness, including OCD and trauma, and how his health deteriorated over time. He explains that he made the decision to change his diet and adopt a low-carb approach to address his metabolic syndrome and avoid a future of relying on medication. To his surprise, he also noticed significant improvements in his mental health, including better sleep, cognition, and mood. The conversation then shifts to the importance of spreading this message and challenging the traditional approach to mental health treatment. Dr. Palmer expresses his passion for helping people and shares the numerous success stories he has received from individuals who have made lifestyle changes based on his work. He emphasizes the need for more people to be aware of the connection between diet and mental health and for healthcare professionals to incorporate this knowledge into their practice. The host shares his own experiences of using lifestyle changes to improve mental health, including a story of a 16-year-old patient who experienced significant improvement after cutting out social media and adopting a healthier diet. Dr. Palmer agrees that small changes can make a big difference and highlights the need for a holistic approach to mental health treatment. The conversation then delves into the topic of ketosis and the use of MCT oil in treating mental health disorders. Dr. Palmer explains that while a whole food diet is a good starting point, some individuals may benefit from going further and adopting a ketogenic diet. He mentions that the ketogenic diet has been extensively studied in epilepsy and has shown positive results. He also notes that there may be a correlation between ketone levels and symptom improvement in mental health disorders such as bipolar disorder and schizophrenia. Dr. Palmer recommends measuring ketones, either through blood or urine tests, to monitor the effectiveness of the diet. Thanks for watching. If you enjoyed the video, please like and subscribe.